We welcome you to our module COPD, Emphysema, HCC 111 from MRA Tips. This module has been developed specifically for MRA reviewers as a refresher on diagnosis criteria, documentation, and coding of emphysema. At the end of this module, the learner will be able to define emphysema and its cause, discuss the criteria for the documentation of emphysema, note the ICD codes that fall under the disease, review the example of the assessment and plan for the disease, identify the exceptions to keep in mind while coding for emphysema. Emphysema is defined as the lung condition that causes shortness of breath. In this, the air sacs in the lungs damage, causing the inner walls of the sacs to weaken over time. Eventually, the sacs rupture, creating a large hole instead of many small ones. It reduces the surface area of the lungs, which in turn affects the amount of oxygen reaching the bloodstream. Cigarette smoking, by far, is the biggest cause of emphysema. Not only does it destroy the lung tissues causing the obstruction of the airflow, but it also causes the inflammation of the airways. Other causes include deficiency of enzyme alpha-1 antitrypsin or prolonged exposure to air pollution. Everyone who is diagnosed with emphysema is said to have COPD. However, having COPD doesn't necessarily mean that a person will have emphysema. Hence, the criteria of emphysema often differ from chronic obstructive pulmonary disorder. The criteria for the documentation of emphysema involves the presence of an MRI, CT scan or a chest X-ray documented along with the date and final result. Let us look at the different ICD codes involved in emphysema. For unilateral pulmonary emphysema, the ICD code is J43.0 and the HCC is 111. For panlobular emphysema, the code is J43.1 and the HCC is 111. For centrilobular emphysema, the code is J43.2, HCC 111. For other emphysema, the code is J43.8, HCC 111. However, it excludes subcutaneous emphysema, which is coded as T81.82 instead. And lastly, for unspecified emphysema, the ICD code is J43.9, HCC 111. The assessment and plan should address the diagnosis and include two support indicators. Code the patient's smoking status, if noted in the final impression. Let's see an example of a progress note. Patient name: Matt Smith. Date of service: December 1, 2018. Date of birth: January 31, 1956. Assessment and plan: emphysema per chest X-ray on January 1, 2019. Unstable. Symptoms per HPI. Start prednisone 40 mg once a day for 7 days. Lab WBC. Will see patient in 4 days. Call the office if symptoms worsening. Exception: in case a person has both COPD and emphysema, only the code for emphysema should be noted. We have reached the end of our short refresher course on COPD, emphysema. We gave you an introduction to the disease, identified the criteria and the ICD code for the documentation of emphysema, reviewed the assessment and plan, and finally discussed the exceptions which are to be kept in mind while coding for emphysema. Thank you for joining us.